90.3 WHBC, where the pharmacist is always available and your health takes center stage. Time to get the latest tips, trends, and truths about staying well straight from the heart of our medicine cabinet. Whether you're here for expert advice or a dose of lighthearted insight, you won't need a spoonful of sugar to help get the medicine down on Drugstore Dialogue. Brought to you by Triborough Pharmacy in Astoria, Queens, where you can ask for Barry or Joe at Triborough.
Welcome to Drugstore Dialogue. I am Barry Newman, the pharmacist at Triborough Pharmacy, located in Astoria, Queens. Today we are going to talk about the program that allows eligible seniors the ability to purchase GLP-1 medications for weight loss for about $50 a month, with Lisa W. Miller, who is the president of Lisa W. Miller and Associates. Welcome to Drugstore Dialogue, Lisa W. Miller, consumer insights, innovation strategist, and storyteller.
Thank you. Happy to be here. Thank you for having me.
Lisa, please share with our listeners your educational background and tell us about your organization.
Yes, so I actually have a business background in marketing, but what I do for my company that I started about 18 years ago, I am a consumer researcher. So I'm one of those people that asks a lot of questions, very curious to help companies understand their consumers, to help them understand their growth opportunities.
I read that you're from Tyler, Texas, where it is considered the Rose Capital of America.
I grew up in Houston, live in Dallas, but Tyler's not too far away.
My wife and I last year went to Amsterdam, and they have in Holland, and they have a very large rose center, which pretty much they distribute to the entire world.
Yes, well, the roses, yes, and the Texas yellow rose, that is a very popular flower, state flower of Texas, and the bluebonnets.
Yes, the yellow rose of Texas.
Yes.
Tell us about the new opportunity that allows seniors to access GLP-1 medications for about $50 a month.
Right. So there was it was passed last fall, and then it just went into effect on July 1st. And basically the way it works is that from your doctor, you have to meet certain criteria, whether it's a certain BMI, which is your body mass index, or you have underlying conditions. And the cost of that, if you meet those criteria, then you can actually have that drug for $50. Now, here's the thing, though, is that if you don't meet those criteria, then the price is still the same, and it could cost anywhere from $300 a month up to $1,000 a month, depending on the dosage.
And your copay.
And your copay, exactly.
Does this include all GLP-1 drugs like Wegovy, Mounjaro, Zepbound, and Ozempic? It
does, to my knowledge, and definitely based on what I've read, is that it does cover a lot of those classes of medicine. But what I will say is that, from a $50 price point, the government is trying to work on, obesity in America. And so really trying to make that affordable. But in the research, I've been studying over 7,500 consumers since January of this year. And when you look at the senior citizens that are possibly eligible, $50 is still too expensive for them. About half of senior citizens who might want to be on it, $50 is still not cheap enough.
Well, maybe there's a coupon out there that could supplement that $50?
I don't think from a government perspective they have that option. If you're on social media, there's a lot of programs around, having these discounts. And what I will say is that what's fascinating to watch over the last couple of months is that the access has become so great. So while the majority of consumers actually get their prescriptions from their doctors for the GLP-1, now you can access that through many, many different channels, whether that's Weight Watchers, other programs like Noom, even programs, online programs like Him and Hers, which are online, basically pharmacy. And so what we're seeing is an increasing number of people accessing these drugs outside of their doctors. Now, for the new senior citizen $50, you absolutely have to get it through your doctor.
Now, you mentioned that they can get it from other sources other than their doctor. Does that mean that they have a doctor on staff, which is a standing order to write those prescriptions?
I will say, Barry, because I am the very curious person, I was a little alarmed at first when I heard, just fill out this form online and you'll get a prescription. I was a little afraid of, is that too easy of access? So being the good researcher that I am, I actually tried on many of the different portals outside of my doctor just to see if I would qualify and if I would get through the gate. And what was fascinating is that there's some that I did get through, and it was kind of shocking that I did. And then the other ones, it's like, no, you don't, based on the way I answered the questions, this is not the right medicine for you. So there's definitely a bell curve of accessibility, and I don't know that that's good. One of the things I'll tell you, Barry, is when it comes to those people that do get their GLP-1 prescription not from the doctor, they're less likely to stay on the drug. And the fact of the matter is, yes, there is a doctor that is prescribing that for them, but you don't have a connection to that doctor. And so when you might have some of the side effects, you're more likely to quit after 30 days if you are getting it not from your doctor.
So Lisa, basically you're saying some of these organizations are just rubber stamping the prescriptions to make money.
I think there's at least one, which I won't call out here. But
could it be Hims?
No, actually, Hims and Hers had reasonable gates. It's actually a different one.
Okay.
That, actually had no gate. And the problem is what's happening is there are people that definitely with a high BMI, 29, 30, 31, high BMIs, it is medically shown that if you lose some of that weight, your overall body health is going to improve. But what's happening is that some of these outlets, we'll call them, or channels, they're basically thinking about it as like vanity weight. That's the problem.
That's the problem.
It is.
And I want to mention that due to social media like TikTok, you have these young girls that are just a couple of pounds overweight, and they don't want to lose weight the traditional way, so they'll take a GLP-1 to lose 5 pounds.
Exactly. And it's that 10, literally some of the advertising from this one company is like, I just want to lose 10 or 15 pounds. And it's a very like a Gen Z female, a 20-something female. And it's encouraging I just need to lose a little bit of weight. And so that's concerning. And I think there's a lot of misunderstanding. And I'm certainly not a doctor or a pharmacist like yourself. But what I can tell is that from reading the reports and so on, there are unintended consequences that can be not good, especially for a younger person, whether it's bone loss, muscle loss, in very important times of their growth and being in their young 20s. At the same time, there's also studies, again, not clinical trials, so it's just correlation, not causation at the moment, but it's basically that sometimes it helps fertility. And so if you think of the losing a little weight, or maybe it's just the lack of inflammation, that now some women unexpectedly are getting pregnant because they didn't think they could get pregnant. And so there's all this noise out there. And I think even though the drugs have been out for decades, the rapid weight loss, there's still some uncertainty of what really are the long-term impacts of it.
There's a Dr. Bruce Herman who's a plastic surgeon in the Dallas area. I don't know if you've heard of him, but he has a podcast. I think it's called Nip Tuck. And I had him on the show, and the topic we discussed was what he calls Ozempic face, where you lose muscle mass in the face and your face looks like it's caved in. So these are the concerns about when overuse of these medications. They have to be used correctly.
Absolutely. And what will happen is if you lose weight too fast, and so what can happen, especially from some of the, non-prescribing doctor kind of things, is it's this game of increase your dosage, which costs more, so they make more money, but then you lose weight super fast. And to your point, you lose the fat in your face. And especially if you're older, call it 45 plus, 50 plus years old, if you lose the fat in your face, you're not going to get it back. And I will say one of the other things I've investigated, which is super interesting, as I mentioned, I'm the nerdy researcher, is I looked up how many clinical trials there have been, and just an increasing number of clinical trials. And so for the listeners out there, that means that there's companies or institutions or pharmaceutical companies that are actually paying money to have a clinical trial to be able to make a claim. And when you look at those, it's fascinating because there's literally one, Barry, that talks about a surgery for Ozempic face. It calls it out by name.
I think they put fillers.
Yeah, well, but they have to get it approved for a certain condition. And so I don't know enough, since I'm not a doctor, I can just read the description and see that that's what it's talking about. But over the last couple of years, there's 1,900 clinical trials that have been started, since this Ozempic craze or GLP-1 craze.
You're listening to Drugstore Dialogue, presented by Triborough Pharmacy of Astoria, Queens, on the voice of Nassau Community College on 90.3 WHPC. My name is Barry Newman, and today we are talking with Lisa Miller, Consumer Insights, Innovation Strategist, and Storyteller. So basically, are all seniors eligible for this program if they meet the criteria?
If they do meet the criteria, yes, they can be eligible, but you have to go to a doctor, like your primary care doctor, to be able to do that. And as I mentioned, there are certain gates that go with that. So if your BMI, your body mass index, is at a certain level, then you automatically qualify due to your weight. But then they have an ongoing list of things, whether it's diabetes, prediabetes, heart issues, that you can have a lower BMI, but then your gateway in is these other conditions.
So is this program available nationwide, or is it only certain states or specific health insurance plans?
I don't know for sure, Barry, but I believe it is nationwide. And because it is part of Medicare, it's going to be available to everybody.
So they have to be enrolled in Medicare Part D or a Medicare Advantage plan? Exactly. Is obesity alone enough to qualify for this program, or are there other conditions coexisting, such as metabolic syndrome?
Well, as I mentioned, the diabetes and also kind of heart issues, those are issues that can qualify if your BMI is under a certain level, and I believe that is either 27 or 28, that you can actually qualify with those other underlying conditions.
Yeah, so these are basically conditions that fit under the umbrella of what they call metabolic syndrome.
Mm-hmm.
Does this price also include the medication only, or does it also include the doctor visits and the lab work as well?
I believe it is just the medication. And so those are the things that they are, depending on what plan they have, it will actually determine what that full price is.
So will there be hidden costs associated with this program, or is prior authorization required to be eligible for this very affordable price?
I believe this is what Barry, based on the research I have done, I think everybody is thinking it's going to be this big unlock for the seniors on Medicare. But the issue is that it's not the case, because even, as I mentioned, half of those people that are interested in taking GLP-1, $50 is too much on a fixed income. And what can happen is then you have the other costs that go along with it, and it's no longer $50. And so while it does unlock a lot of accessibility for a lot of seniors, it's not the end all be all. And I don't think I haven't heard people really talking about it, but it is very clear in my research.
Lisa, how long can someone stay on a GLP-1 medication?
Believe it's doctors, based on where your doctor is, the big discussion point is really around how fast, and now a lot of consumers are doing what's called microdosing. And so microdosing is a way to not have such dramatic weight loss in a quick period of time. And so some consumers are being able to stay on it longer. Now, I will tell you, as I mentioned earlier, there's a lot of consumers that drop after 30 days.
Because of the side effects.
Well, can I tell you, and this is when you different, men versus women out there listening today. But there are clinical studies that show men don't have as many side effects as women to GLP-1s. And so what's happening is, think about this. When you think of wave one of GLP-1, we actually, when it was diabetes, it was kind of losing weight was kind of a side effect, a really good thing. And then what started happening is $2 billion of advertising, whether it's Roe with Serena Williams, it's the Oprah Winfrey effect. I believe her show was in 2024, and just trying to get it in the public conversation that obesity is a disease. But if you think about $2 billion of advertising, but it's targeted at women. But what's happened is, in my data, and this is backed of 7,500 consumers over the last 6 or 7 months, is that men is actually the fastest growing demographic to be trying GLP-1s. And nobody's talking about that. But for all the listeners out there, think about it. Do you have people in your network that are men that are on GLP-1? Men are starting to talk about it. I literally was at a conference this last weekend, and a friend of mine definitely looked like he had lost a lot of weight. And I was like, Scott, you look great. You lost a lot of weight. He goes, yep, the miracle of modern medicine. Mm-hmm. 50 pounds he lost, and his wife had lost 50 pounds, and they're both taking Zepbound. So men are seeing results of their women friends. And now they're like I said, the fastest larging trial group that I see in my research.
Well, if you look at plastic surgery, traditionally people thought it was women who went for plastic surgery, but now there's an increasing amount of men that are in fact going for plastic surgery. So men are starting to care more about how they look.
Absolutely. And I can tell you that what is so fascinating is when you look at the demographics of GLP-1 users today, it's basically when you have a woman, that woman tends to be a little bit older and maybe more entry level in her job. Whereas the men, they tend to be younger, more millennials and Gen X, and they tend to be in more senior level positions. And so that ties in very closely. I have to add that to my survey, Barry, about plastic surgery.
I had that on a previous show. That was discussed.
Yeah. Oh, yeah. No. I'm going to just add it out of my own. As I mentioned, I'm a very curious person.
That's great.
So, I think that would be a fun statistic to have to correlate with GLP-1 because, peptides and GLP-1s and all of these supplements for men, to, stay the vitality and looking young and powerful, I guess.
What is the science behind how GLP-1s help people lose weight, Lisa?
Well, I am not a doctor, so I may have to pass on that one. I can tell you what I know about it from my consumer research. But basically what it does is from a metabolic standpoint, it actually reduces the craving that you have in your brain for food. And if you have seen any of the advertising or talk to anybody, consumers will talk about it as, reducing that food noise. And so basically what that is that you don't have an appetite or a craving for things that might have, whether it's sugary drinks or whether it's desserts or even alcohol. And some of the things that, again, the unintended consequences is now some of these clinical trials, from a psychological view. So that's a physiological view. But from a psychological view, even things like gambling and alcoholism, there's discussion, not evidence, but discussions around, what some of those other applications could be for that are less about food.
I think that the GLP-1s work on the appetite center in the brain, the hypothalamus, where people start to feel less hungry on these medications.
Definitely. Yeah. And that's, like I said, so from a non-scientific world, it's the consumers, the way they talk about it is that I just lost my appetite. I don't have a craving, that food noise. There's a friend of mine that has been on GLP-1 for a while, and she literally talks about the fact that previously, before GLP-1s, she would be literally craving sweets like all the time. And then with GLP-1, that center in the brain actually...
The hypothalamus.
Yeah, the hypothalamus, actually. Yes.
You're listening to Drugstore Dialogue, presented by Triborough Pharmacy of Astoria, Queens, on the voice of Nassau Community College on 90.3 WHPC. My name is Barry Newman, and today we are talking with Lisa W. Miller, Consumer Insights, Innovation Strategist, and Storyteller. So, Lisa, realistically, how much weight can people expect to lose on these GLP-1 medications?
It really, the average story is it depends, because if you are, significantly overweight, but it's not uncommon for consumers to lose 30 to 50 pounds very, very quickly. And that's part of the somewhat alarming concern that a lot of medical professionals have, is the rapid pace at which it happens. But it's all a percentage of what your total weight is. So it's not really, it's difficult to actually have an average, but 30 to 50 pounds is not uncommon when you're just in the first couple months of taking it.
I think maybe you could lose 15 to 20% of your body weight, but it is also based on lifestyle changes. You have to eat better, you have to get more sleep, you have to exercise. It's not just simply taking a magic medicine and expecting to lose weight if you're still eating jelly donuts all day.
Right. And I think one of the concerns that consumers have that I see in my data is, there is a concern that when they go off the medications that they will gain the weight back. So there is a concern. And
yes.
I've even asked the consumers about their perceptions of, if your doctor said, would you need to be on it for your life? Because if you do think of it as a cholesterol medicine or a blood pressure medicine, would people be willing to take it their entire life? And those that have been seeing positive results, they actually are saying, yes, if it helps me live a healthier life. But I think, again, the medical evidence is still, what is known as the likelihood to gain the weight back is pretty proven. How long is too long to be on the drugs? There's still, clinical studies happening right now. But again, from the consumer view, there's certainly awareness and concern. And that's also why microdosing, which is just the smaller doses over time, that it can actually just stabilize, that you don't actually lose weight, but then you actually are getting rid of that brain craving that you have. So it's enable you to maintain your weight.
I believe because of the side effects associated with these medications, they're really not intended to be a lifetime chronic medicine. It's basically you lose your weight and then you keep your weight off with lifestyle changes.
I don't disagree with you on that. I think there's so much discussion because consumers are asking their doctors about it. And I don't disagree with you is that there's no evidence to say that it's safe to take as a lifelong medication. And what consumers have to learn, and you said it just a second ago, is it's an aid to losing weight, but to your point, you can't eat chocolate donuts and jelly beans and all of that and then expect to keep the weight off. And the muscle loss is definitely a concern as well. And bone, not only muscle loss, but also bone density loss. And it's not caused by necessarily, from a physiological standpoint, the drug itself, but it's compounded by the sedentary lifestyle where even, people in their 20s and 30s that have been on GLP-1 for a year, they're showing signs of osteoporosis, which is tragic.
2 out of 3 Americans are overweight because of that sedentary lifestyle.
Mm-hmm.
So, Lisa, how long does it usually take to see some good results on these medications?
Again, I think I hate to always just say, but it actually depends. The data actually shows that some consumers have to switch brands of medication.
Yes.
So it might be that you try Zepbound and you have no results. And then you try Ozempic or Wegovy and you see lots of results. There's also the differences between injections and the pill forms.
Right.
And so the injections are actually more likely to have success than the pill forms.
Agreed.
So people, so unfortunately, there's no black and white answer to that, but many consumers are having to try multiple things. I do want to comment on something, Barry, and you haven't asked this question, but there is a lot of publicity and talk around all of the negative, side effects, the nausea,
Yes.
the bone, all these things. I do want to comment, though, on the fact that for those that have had very positive success, there is a lot of joy in the outcome of actually losing weight. And so yes, there's I'll go ahead and use the word, there's a battle ahead for those people to keep the weight off. But we don't hear enough about the positive outcomes of those that do lose weight safely and under medical supervision. They do it the right way, and they feel better, and they have better healthy outcomes and improvements in their overall health. And we talk a lot about the outlier cases and the negativity, but I do think it's important to say that some of these drugs, have had some very positive outcomes for people.
What are the common side effects, would you say, associated with these GLP-1 medications?
Definitely nausea is the biggest one reported by females, and also just stomach cramping, hair loss. There's quite a number of them, but those are the ones that tend to be most reported.
How about vision loss and stomach paralysis?
I have heard of those, but I don't know that those are as pronounced as some of the nausea is one of the ones that is more common. But yes, I have read about the vision loss and so on, but those are much fewer cases.
So what health benefits beyond weight loss are we also seeing with these GLP-1 medications?
Well, definitely the overall improvement of metabolic health. And so whether it comes to the inflammation in your body, the heart itself, the circulation, when you think about the blood and the oh my gosh, I lost the word, but the circulatory system is what I was trying to say, is with less weight, the circulatory system improves and inflammation. So there's a lot of other positive outcomes once you can lose the weight.
With these drugs, people are also looking if it's an anti-cancer agent. Does it help in Alzheimer's? Does it prevent psoriasis? Does it help with sleep apnea, even heart disease?
Well, this is the $20 billion question, Barry, because there have been so many correlations that are being noted because of particularly the inflammation that comes with losing weight. I don't believe that there's any clinical proof yet, but there are lots of suppositions and all of the things that you mentioned that people are seeing positive results. And even, as I mentioned, one you didn't mention was fertility.
Oh, really?
Yes, even, being able to get pregnant when you thought that you could not. And what's happening is part of these clinical trials, they're starting to do studies to actually be able to validate a clinical use case for that medicine, for GLP-1s, for those diagnoses, for those conditions.
Thank you for being on the show today, Lisa W. Miller, president of LWM and Associates. If you wish to write to the show, please write to me at drugstore.dialogue@gmail.com. My name is Barry Newman. Thank you for listening to Drugstore Dialogue, brought to you by Triborough Pharmacy of Astoria, Queens. Our shows are available wherever you listen to podcasts, and always right here on the voice of Nassau Community College, 90.3 WHPC.